All right, we're going to go ahead and get started. Today is Wednesday, September 18th, 2024, and we're about to start our special city council meeting. We are going to be discussing our Regional Homeless Alliance, and it'll be in a workshop setting. So at this time, I'm going to go ahead and call the meeting to order. It is 4 o'clock, and Madam Clerk, if you wouldn't mind calling the roll, please.
Councilmember Estrada.
Here.
Councilmember Carwin.
Here.
Councilmember Sobek.
Here.
Mayor Pro Tem Dinas.
Here.
And Mayor Zimmerman.
And I'm here. We're going to go ahead and stand for the flag salute. I see Daniel Temple's here. Dan, if you don't mind leading us, please. Thank you.
Please stand, put your right hand over your heart, and let us begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you, Dan. All right, so with that, we're going to go ahead and get started. I believe that our Captain Dave Gutierrez is on his way to the podium to help us with our Regional Homeless Alliance Assessment and Action Plan. Welcome, sir.
Good afternoon, Mayor, City Council members. Dave Gutierrez, Captain with the Menifee Police Department. And yes, I'm here today to speak about the Regional Homeless Alliance Assessment and Action Plan and kind of what the city's efforts have been towards engaging those experiencing homelessness in the city. So we'll do just that. We're going to talk a little bit about the legal landscape and some potential thoughts that we have on some ramifications of those laws, what resources we have available to us now, and what our efforts have been, talk about a few of the successes, and then kind of what are our next steps in moving forward with this. And then we're going to have Ms. Susan Price from Baker Tilly come up and actually review the regional assessment report and action plan with you. So just kind of a precursor to all of this, looking at a national, some of the numbers nationwide. From in 2013, there was about 550 sheltered and unsheltered homeless folks throughout the United States. And in 2023, there was 580,000, so an increase. Significant to those numbers, though, about 30% of all those experiencing homelessness are here in California, and 50% of all the unsheltered homelessness across the nation are here in the state of California. So we wanted to talk a little bit about the legal landscape. In 2014, Proposition 47 was passed by California voters. And essentially, in a nutshell, it was termed the Safe Neighborhoods and Schools Act, but it reduced drug possession of dangerous drugs, cocaine, heroin, methamphetamine, to name a couple, from felonies to misdemeanors. And why that's important is because now that they're misdemeanors, oftentimes they don't even go to jail if we do find them in possession. But if we do, they get booked, and oftentimes they're out in a short period of time. Under the old law, if somebody was convicted of the felony, they were required to go to drug diversion court, which was an accountability measure. They went in, the hope was they got clean, and then they became, productive members of society, and hopefully were able to turn their lives around. Now, effectively, that is gone. So we're hoping there's some laws coming out, or a proposition in November that may help with some of that. But you see an increase in homelessness from people. There's a lot of individuals addicted to drugs and alcohol on the street, and without that help, they stay on the street. It's very tough to get them off of the street, oftentimes losing their job and access to finances. I'm going to turn it over to our city attorney, Mr. Jeff Melching, to discuss a little bit of Johnson v. Grants Pass and then the governor's executive order.
Thanks, Captain. I think before talking about Johnson, I want to go back 5 years and talk about Boise, there was a case that came out from the Ninth Circuit Court of Appeals in 2018 involving the city of Boise. And in that case, the Ninth Circuit determined that enforcing anti-camping laws was cruel and unusual punishment under the Eighth Amendment of the Constitution, and therefore it couldn't be done. And where it could be done, it had to be done under strict regulations established by federal judges in individual injunctions in cases. And so one thing that's happened over the last 5 or 6 years is not much in terms of the enforcement of anti-camping laws and in dealing with encampments locally. the captain and the police department are going to talk about what we could do, but our hands were tied in substantial measure over that period of time. Earlier this year, the Supreme Court released its decision in Johnson versus Grants Pass, which mostly, in the main, undid the Boise decision. And I was just going through Johnson versus Grants Pass, and it sort of explains, there's two sentences here that explain why they did that. In describing Boise, the court said, instead of encouraging productive dialogue and experimentation through our democratic institutions, courts have frozen in place their own formulas by fiat. Issued by federal courts removed from realities on the ground, those rules have produced confusion, and they have interfered with essential considerations of federalism, taking from the people and their elected leaders difficult questions traditionally thought to be their province. In other words, the Supreme Court in Johnson versus Grants Pass really restored the idea of local control to the question about how to deal with homelessness or people experiencing homelessness. So that's the one thing that happened, and that's sort of why this conversation ends up being timely, is because those chains, such as they were, have been removed from the city's ability to address at least the anti-camping piece of it. Then, right after the Grants Pass decision came out, the governor issued an executive order. And the executive order, first thing to understand about the executive order is it's not binding on the city at all. It encourages the city to do what the governor urges, but it is not binding. It's not a rule or a law that we have to follow. What it does, though, is it drills down on the question of homelessness, from the question of homelessness to encampments specifically. And again, I'm sorry for reading, but he really summarizes in one paragraph what he's trying to get at. He says, it is imperative to act with urgency to address dangerous encampments which subject unsheltered individuals living in them to extreme weather, fires, predatory and criminal activity, and widespread substance abuse, harming their health, safety, and well-being, and which also threaten the safety and viability of nearby businesses and neighborhoods and undermines the cleanliness and usability of parks, water supplies, and other public resources. And so that's what the executive order is attempting to get at. And what it does, again, not binding on the city, is it prioritizes finding sheltering options for people experiencing homelessness while also recognizing the public health and public safety benefits of removing encampments. And with that, I told the captain I'd only speak for 43 seconds. I think I've spent my time. I apologize.
It was close. So all that's important because now what's going to happen throughout our region and beyond is we're likely going to see other jurisdictions begin to now start to enforce and displace large numbers of homeless individuals from their cities. And it's already a migratory, issue with homelessness. They don't stick to jurisdictional boundaries for the most part. So other cities that don't have as significant of a homeless issue in their city may experience increased numbers. So that's kind of why we're here looking at, we thought this was very timely to look at kind of our historic approach to homeless challenges in our city and see what we can do moving forward and how we can always improve our service to the community. So in 2016, well before the Menifee PD began in 2020, the city of Menifee joined forces with Lake Elsinore, the city of Marietta, Temecula, and Wildomar, and they formed the Regional Homeless Alliance. And really the purpose of that was to begin to work in collaboration to address issues surrounding those experiencing homelessness and start working as a unified group collaboratively throughout the region. As you know, on July 1st, 2020, great day, Menifee PD started. As we were forming the police department, we knew that there were some homeless issues there were homeless people, those experiencing homeless in the city of Menifee, so we wanted to make sure that we were able to properly address that. So one of the specialty units that we did start with on day one was our problem-oriented policing team. It consisted of 2 police officers, a sergeant, and a community service officer back then. And their primary mission is to proactively address quality of life issues. And there's several ways that they do that. Oftentimes patrol, they're the first responders that go out there and handle things, but they're not often suited to be able to handle those long-term issues that take more creative solution mindset and just the ability to engage those in a long-term way to get rid of the quality of life issues that many communities experience. And so they can do that through data-driven policing. They do it through crime prevention, through environmental design. They do it through building strong relationships with the community, including our business owners throughout the community. We also, very early on, united with the Community Services Division, Community Development Department, and our POP team sits on the Development Review Committee, and they provide advice on security measures, crime prevention through environmental design efforts, and it works really well for new developments coming to Menifee, but we did not get that opportunity for the existing developments that were here before we started. And so that sometimes is a challenge because we're working to develop those relationships, and we require cooperation amongst the business owners to get some of those problems solved. Today, we do work with the Riverside University Health System. We have a dedicated team of 2 people, and I would like to introduce just a couple of people to the City Council, if you don't mind. Carrie White, she's a Behavioral Health Specialist 3. Beatrice Gomez, she's a Peer Support Specialist. And the 2 of them are rock stars. They're assigned to Menifee PD. And then I also wanted to introduce Dr. Larissa Villarreal. She's a Mental Health Services Administrator for RUHS. Thank you for joining us. So the HOPE team is funded through the police department's budget as well as the community development block grant. And they go out daily to engage with those experiencing homelessness. It's been a great partnership. There has been some successes, and we'll talk about those in a minute. One of the early on challenges that we experience in the city of Menifee is we have a very supportive and engaged community. They have big hearts, and a lot of times we see them engaging with the homelessness and offering food and sometimes clothing and sometimes money. And so we knew it was important to get in front of that because we want them to help because that's critical, but we want them to do it in the right way. So we began to utilize the Responsible Compassion campaign, which is give those things to individuals, organizations that can truly help those homeless individuals instead of enabling them. We find that if you enable them, they stick around and they're not getting the help that they need. So the community has been a big part of that. Periodically we go and hang door hangers throughout the community, and so our POP team does that, our volunteers do that. It's a big effort. Recognizing the need to do more, we enhanced our problem-oriented policing unit, and now we have a homeless liaison officer. She's here with us today, Rochelle Hunter. We have a community behavioral assessment team officer as well. And we have a behavioral health specialist, a clinician, medical clinician assigned. They work together. They patrol in a patrol car together, and they collaborate closely with those experiencing mental health challenges in the community. In addition to RUHS HOPE, we also house the mobile crisis management team, and that's consisted of a clinical therapist, a behavioral health specialist, a substance abuse counselor, and a peer support counselor. And they specialize in short-term case management. Beyond all of those resources, we also prioritize collaboration with neighboring agency, business owners, community partners, nonprofit groups, and faith-based organizations to address homelessness. We do value deeply partnerships with the businesses, as I've stated. And when we have people that are willing to cooperate with us and do things to their locations that make it less attractive for homeless people to kind of hang out, homeless individuals to hang out, then it's very useful to us, and we're working together in partnership. Technology also is helpful, license plate reader cameras, surveillance cameras, those types of things. So some of the successes that we've seen in the last 18 months, our HOPE team, our POP team, MCMT, together collaboratively, they've made outreach with 1,414 people. They've made 1,414 contacts. That entails 171 individuals. Something of note, they often have to do repeated contacts with individuals before they're willing to accept resources. So 16 of those 171 individuals were with people that they had to make contact with between 16 and 100 times. So oftentimes they can deal with them 3 to 4 times in a week. Our data shows that we have 18 regular individuals that are experiencing homeless in the city of Menifee. And
what was that number again, Captain?
18. Sorry, it was like surround sound.
So you said we have 18 homeless individuals?
So our data shows, so we make contact with a lot more than that, but what our data shows is that we have 18 regular people in the city of Menifee that are experiencing homeless. So in other words, they've been here for some time. They are likely part of that 16 that have been contacted multiple times, up to and including 100 and more times.
Hey, Captain.
Yes.
Can you please help lay out for me and the public how there are a lot of moving parts here. We have the POP team, the homeless liaison officers, the CBAT team, HOPE, Riverside Health.
Yeah.
So could you give us maybe a short synopsis for a play-by-play of where all of these entities get triggered? Let's say you come up to a homeless individual. How would all these entities play out in play-by-play?
So a lot of it is proactively. So our patrol officers, our HLO officer, the HOPE team, MCM, those are the proactive measures that go out daily and are looking to interact with those that are in our community that are experiencing homelessness. And so upon that interaction with that individual, if they're willing to accept the services, our HOPE team is able to engage them in a variety of different services. It could be trying to get them to get a driver's license because they don't have identification, benefits available to them through Social Security, obviously housing. One of the challenges that we do experience is in order for them to rise to the level of being able to get them into, prioritize them into some sort of housing, they have to have been what's called chronically homeless. And the definition for that in the county is you have to have been homeless for more than a year or more, or have experienced homelessness 3 to 4 times in a period of 3 years, equaling a year or longer. And so the street exits, immediate street exits is what we have a challenge with, right? Not being able to put them into a shelter while you're providing those services and getting them what they need.
So sorry to interrupt.
Yeah.
So to clarify, so there's not necessarily one specific entry point. It's the POP team, the homeless liaison officer, the HOPE team. They're all driving around, and whichever one gets to them first.
Well, that's kind of simplistic, but in a way, yes. Our POP team does a lot more than just focus on homelessness. They're dealing with all kinds of quality of life issues. It could be a location that is a party house for a long period of time, and they're working to figure out how to solve that. But our homeless liaison officer and our RUHS HOPE team, they are absolutely out. That is their primary focus, is dealing with homelessness. We get calls from the community as well, and when those calls for service come in, they are the ones, our patrol will go out and engage these individuals if they're loitering or doing something else. And then our patrol officers can make a phone call to our homeless liaison officer or our HOPE team, and then they can come out and engage them. So yes, there is a proactive component to it, but there also is a reactive component to it. And they're making lots and lots of contacts with those experiencing homelessness. So the point in time count for 2023 was 25, and in 2022 it was 28. So there was a slight reduction. So even the efforts that are going on, they're absolutely happening, but you have to remember the point in time count is a very small window of time, one day for a couple of hours. And you go out and you're looking for individuals that appear as if they're experiencing homelessness, and they're documented. But again, our more thorough data shows that there's 18 individuals that are contacted on a frequent basis, and that they're all regulars. So within some of those successes as well, in the last 18 months, 29 individuals received Narcan and fentanyl test strips, and that's really for harm reduction purposes. 10 were connected to transitional housing. 1 was placed in permanent housing, and then from April to June of 2024, 12 were linked to ongoing mental health services, and 29 individuals were screened for substance abuse. Again, another benefit to our HOPE team here is Carrie White. She's a BHS 3, and so she has the ability to screen them and place them in treatment without a middleman because of her position and her training, whereas other communities that don't have access to a BHS 3, you have to get them connected to somebody else for the screening in order for that to happen. So we're fortunate here in Menifee that we have a dedicated team to do that. There are other HOPE teams just like them throughout the county, but typically they are not designated to one city. They have a much larger service area, which makes it a little bit more challenging for them to get things accomplished. Let's see. So in late 2022, the city of Marietta, they secured a $500,000 federal grant. And really that was for the RHA to do an assessment on what all the cities were doing, what was being done well, and then what areas are there for potential improvement to work closely together from a regional approach to even have a more impact on quality of life in all of our communities. The report had 26 recommendations, and I want to introduce, actually, you know what, I'm gonna talk about moving forward. So some of the things that we're looking at now is we do partner as a police department with our other agencies in the region, but really specifically focused on homelessness. We want to strengthen those partnerships and begin to work even closer with them, because a lot of times if we're doing this in isolation, if Menifee's doing their thing with homeless and Marietta's doing their thing in Temecula, you have the potential for duplication of efforts, and then those individuals aren't tracked properly in the best way. We're not tracking them, but we want to make sure that if somebody needs services in Menifee today, that if they show up in Temecula tomorrow, that they'll know about that, and then we can work together to help that person. So we also are looking and exploring opportunities to enter into an MOU with some of the cities that are involved in the RHA, really to work together. Some of the more recent information, and Suzanne Price will talk a little bit more about that, is there's a lot of grant funding available for those cities that are willing to work collaboratively within the region, and we want to access that grant funding. And in fact, the County of Riverside Housing and Workforce Solutions grant, we just learned last week that there's a possibility to get some funding from that, and Menifee, the city of Menifee, has been invited to participate in that, and we'll be researching that and seeing how that can benefit the city of Menifee, and then obviously we would bring that back to council for further discussion. So with that, I would like to, one other thing I want to mention, and so I don't know if the council has heard of Healthcare in Action, but it's one of the barriers, obviously, is an unwillingness to accept services. But when individuals experiencing homelessness have medical needs, oftentimes that can help connect us to them and start building those trust barriers with them. And so Rochelle Hunter has been working close with Healthcare in Action. It's a state-funded nonprofit organization. They're working in the region already. So if they were going to be here on Monday, something came up, and they're going to be in the city of Menifee. It's a mobile unit that has a physician assistant in it. They can do different types of treatments for those experiencing homelessness. And they're going to be in our city tomorrow, and they drive around looking for those individuals, and they meet them where they're at. And the hope is then from that, they will be able to get connected to services to get them off of the street. So with that, I'll introduce Susan Price. She's one of the advisors for Baker's Tilly to review the assessment and action plan.
There's a duck in the room. Good afternoon, everyone. It's my pleasure to be here today in the city of Menifee to talk about the homeless strategy that really has been in the works since 2016, when your 5 cities collaborated with a city council resolution to come together on the RHA, the Regional Homeless Alliance. And with that, I'm going to talk a bit about kind of the process that we went through, and then a bit about the report itself, and then talk about opportunities to collaborate and why a regional approach is hopefully the best and most effective approach for your city. Start by just acknowledging that each one of your cities has a current response to homelessness, and what has just been described by Captain Gutierrez is a pretty excellent response that integrates your police department with a clinical approach to address behavioral health. When I say behavioral health, I'm talking about mental health and addictions treatment. And since, as it was mentioned by your city attorney back in 2014, Prop 47 has really seen a shift in the demographics of homelessness to where these sorts of clinical services have become very much paramount to our effectiveness and our success on the streets with homeless populations. The actual strategy that Baker Tilly was hired to embark upon was to take a look at what each individual city was doing and really determine how it could synchronize its efforts into a regional approach. And I just like looking at this map for a moment to see that Southwest Riverside County, it makes perfect sense that these 5 cities would align, because within the county of Riverside, the preponderance of homeless population is more in the urban areas of Riverside, the city of Riverside, in that general area. And so when you look at the point in time count, which I'll go over in a few minutes, you see that the number of homeless people in Southwest Riverside County is fairly small. If it's 28 in your city, it would be difficult to gain the attention of the broader region to exemplify the need and the need for resources when you have 28 homeless people comparatively in the broader system, right? So when you come together in 5-city collaboration, what that does is give more attention to the needs that you have. It shows the proactivity of your elected officials in each city to say, we want to take a proactive approach so that we don't become one of the cities that we read about in these larger urban areas that's really struggling and on their heels to address the volume of need in their community. You've come out of the gate with a clinical approach aligned with your police department, and you're already ahead of the curve. So I just want to acknowledge that before we go any further. So the process itself was we talked to each of the 5 cities to conduct interviews. We received lists of stakeholders to interview, from city management, elected officials, department heads, school districts, service providers, advocates. We talked to everyone that you wanted us to talk to, and probably a few more, just to find out how everybody was feeling about your response to homelessness, what gaps there are in the system, what the strengths are, and so forth. We also did a resource inventory and a gaps analysis, which I'll talk about in a moment. And as was mentioned, there were 7 goals in the report consisting of 26 recommendations. Don't be overwhelmed by that. You all have a copy of the report. The report is actually an A to Z approach to how to end homelessness in your region. It's an incremental approach. It's a strategy that's multi-year. This is not something that you would do in a 6-month period, and it really just covers all the different components of an ecosystem within Riverside County. I'm going to blaze through these relatively quickly and get to the actual plan. But I will say to you that it was very clear across all 5 cities that they're experiencing a mental health crisis and an addictions crisis in our communities with regard to people experiencing homelessness. You've already heard that. I don't need to portray that much further, but compounded with the COVID pandemic and the fentanyl crisis, our police departments are frontline workers. The most effective response is to 911, right? So our police departments are on the front lines responding to our community. The other thing that we heard very frequently is that there was an inconsistent connection to the broader County of Riverside continuum of care, which is a system of homelessness resources that, you know, in Southwest Riverside County, it would be difficult to stay connected to that broader continuum of care because it would be such a travel just to attend their meetings, and they have a lot of meetings. But it's good to know that, you know, and I was impressed to hear that you had the county co-located at your police department headquarters. That was amazing, and it certainly yields volumes for you probably every day. So, it's weird, okay. Primarily data was another point, and Captain Gutierrez brought this up. So when all of your personnel go out to talk to a homeless person, they don't have the luxury of data on each person. Everything is a cold call. It's a first contact. You don't know any service history, any background on that person, because most of your direct service people are not connected to the homeless management information systems. That system is operated by the Riverside Continuum of Care. And really, there weren't a lot of outreach teams or outreach personnel in the Regional Homeless Alliance that were using the HMIS system for the clients. And so there's two things related to that before I move on. There's that duck again. The first thing is with HMIS, you get the background of service history on an individual. You know what resources they've used in the past, so you're not starting from square one with every individual that you have contact with. You can see where they have accessed resources in the past or not. The second piece that's most critical is that when a client is put into the homeless management information system, they're also put into the queue for regional housing resources. So where you may not have affordable housing or permanent supportive housing that's appropriate for a homeless population within your city, within the county, they have the housing authority, they have project-based vouchers, they have housing choice vouchers, people refer to as Section 8, housing subsidies and things of that nature that really no one in the RHA would have access to those unless those clients were entered into that system. So I've been kind of harping on that throughout the course of the project. The other thing I'll mention is that funding to the RHA has been limited. Most of the cities are using general fund or serving, you know, funding existing employees like police personnel and other personnel using general fund dollars. With all of the money coming down from the state over the last 8 years, it's tremendous amount of money coming to the County of Riverside and the continuum of care from the state. Most recently, I think Captain Gutierrez mentioned it, the HAP program, HAP Round 6. HAP stands for Homelessness Housing Assistance Program, I believe. That funding source, RFP, has come out, and it's actually prioritizing Southwest Riverside County RHA specifically. We've come a long way in 1 year for that to be the case, and I'm super proud to say that the county is acknowledging your collaboration and is actually offering funding to you for collaborating, because individually you won't solve homelessness. None of your cities will solve it on your own. Collectively, you can. So with that, I'm going to move on to share really quickly what has already been said. I don't want to duplicate that, but I did spend time on ride-alongs going throughout all 5 cities. I went out with your police department, spent a couple hours driving around your city, showing me hot spots, introducing me to folks that were experiencing homelessness. I like to do that firsthand to really get a sense of what your street outreach teams and your law enforcement are dealing with, and which locations and why. Sometimes there's a why associated with these locations. The other thing that's challenging in the RHA is that there's a lot of open space, a lot of privately owned land that's 602 letters are being used so that police can enforce where you have absentee owners of land. And so there's just a lot of complications related to the vastness of your city and the vacant spaces. Talking about hospitals, the healthcare system in your region, there's discharge planning needed. Some of the hospitals provide detox services, and it's important when someone goes into the hospital for detox that when they exit that, they're going to a more appropriate location than back to the streets. For obvious reasons, we want to be able to create that safety net and the streamlining of resources so that people don't end up back on the streets, because as was mentioned, you have 18 folks in your city that you contact regularly. It would be great to focus on the needs of those 18 people and reduce that number. Even though the point-in-time count is every 2 years, that's a baseline number. The number of 18 is the number to focus on for your outreach efforts and for your clinical efforts to make sure that those 18 people get into programs and services. The other thing that was mentioned earlier, very difficult to find a shelter bed on the day that you need it. The day that a person says, I'm ready to go, I want help, I can't do this anymore, there frequently isn't a bed available anywhere in this region. That is a challenge. Certainly when someone allows the window to be open, you want to jump through that window. And that is a challenge for this area. It's something that we'll talk about in a moment under the gaps analysis. So mental health addictions treatment, number 1 and number 2. Issues for all of you. It's not unique to the RHA. It's not unique to Southwest Riverside County at all. Across the state, we just don't have the infrastructure to address those needs that were created for us back in 2015. I'm not going to go over the entire homeless count for you. You know what that number is. But when you look at Menifee, 28 and 25, the sheltered number being 4 in 2022. I don't know why it was a 0 in 2023. Either the program didn't report or the program didn't have clients in those beds. But when you look at the number of 419 as sheltered and unsheltered for this region, it's about 11% of the county of Riverside's total homeless population per the point-in-time count. So 11% may not yield a tremendous response from the county and its funding sources and its response to homelessness. However, I will share with you in the course of the last year, because of the RHA, we're seeing a lot more activity from the county integrating its efforts into the work that you're doing here. This chart was in the plan, and it talks quite a bit about just the repeated contacts that all of the outreach teams are having, from what the unsheltered number is to how many people they know by name. They've been knowing for years. In the case when we did the inventory in Menifee, it was 10 that were reported by the team. Today it was 18 people that you're familiar with. And so we took a look at the 181 as unsheltered number, took a 60% of that as to who would take a resource on any given day, and determined based on limited data, because we didn't have any data really in the HMIS system, it was anecdotal by the outreach teams, that 60 beds of shelter would be very beneficial to your 5 cities if you could cite a program or smaller programs up to 60 beds, and to be able to create 48 beds of behavioral health inventory. And that, of course, is not something done by the cities. It's a commitment from the county. So that's basically what we're looking at as far as development of infrastructure for the RHA. And so with that, I want to just mention the Encampment Resolution Grant, which covers the Murrieta Creek Trail. 3 cities within the RHA participated in that. It's not actually located in your jurisdiction, but that grant was submitted to the tune of $12 million. And if that's funded, we'll find out by the end of September, early October, if that's funded for the RHA, the county has put forward behavioral health beds set aside for that population. So that is a huge transformation for this region to be able to get a grant of that size, to be able to get that allocation of behavioral health beds set aside from the county, in addition to creating that regionalized street outreach team to address encampments along that creek.
Excuse me. I was wondering, where are the locations exactly of, can you go back to that last slide? Where is Project Touch? Where are the beds for Project Touch, the beds for the Anchor? And it says the ranch, which is outside of the RHA region. Where are those located?
Project Touch has beds in all of the cities, all 5 cities. Project Touch has locations for both individuals and families. The Anchor program, it's a 16-bed program in Lake Elsinore, and the 6 beds that are set aside for the ranch, I believe it's in Paris. It's operated by SWAG.
So Project Touch in Menifee, is there a location?
That's correct. I don't have the address
Yeah,
with me,
got
but we received addresses for all of their programs, and then we mapped them, and it's in the report. It looks like a heat map, and it shows the number of beds in each of the cities. It's not broken down by individuals or families, but it basically just shows how many beds Project Touch has, which is it's 265 total beds in the RHA. And that was the next slide. So, and I talked about those, so let me move on. Fundamentally, these are the foundations that, I think are important for the RHA, is getting shared data. All of your cities collect data. I've seen reports from each one of your cities, but they're all so different. It would be great if the cities got together and decided these are the basic 15 data points that we're all going to collect, and then we're going to collect all the other things that we want to do for ourselves specifically. But what that does is it allows you to pool your resources together among the 5 cities and go after these grant applications and bring some real money into your city to reduce your general fund investments. We're already seeing that start to happen with the encampment grant, the HAP grant. It's starting to unfold. And so that's great. And the county's been wonderful to work with. The Riverside County Continuum of Care is operating on all cylinders. You guys are very well connected. You've got a team of people here. It's pretty amazing to be able to work with the Riverside COC. So regionalized street outreach, it would be helpful to have a nonprofit outreach provider in addition to law enforcement. Law enforcement is jurisdictionally specific. They can't go outside of their jurisdiction. They have no authority to do so, to enforce, or conduct any actions. And so we strongly encourage that a nonprofit outreach provider work across all 5 cities, because the population doesn't know boundaries, and you can work with these folks, get them into the HMIS system. Law enforcement is not able to use HMIS. They're not permitted in the federal policy for HMIS. They don't allow law enforcement into that system. So you would need a nonprofit or some other partner that wasn't law enforcement to be able to enter that. As mentioned earlier, and I just want to make a point, that there are no points of entry for a homeless person to go and accept, to get help on their own. They kind of need to wait for an outreach worker to find them. There aren't any access points, resource centers, and cities can define that any way they want, as far as whether it's a senior center, a library, whether it's City Hall. They know to go to Brian Ambrose's office in Murrieta. So they kind of go word of mouth as well, but you could create like a resource directory and give people the ability. You'd be surprised, a lot of homeless people have their own cell phones. They would be resourceful on their own. They just really don't know where to access resources in this area. And I've talked about all of the rest of these pretty much, but I think in the RHA too, not just for the response on the ground to the homeless population, the capacity building of you all binding together to develop some resources. It's not realistic to think you're all going to individually create that system, but together you could. And then from there is also advocacy, and you've already gained the attention of the Board of Supervisors, they are paying attention to the RHA, and they're very interested in these types of collaborations. And I won't go through this too much, but just to say that these are all the necessary ingredients of a successful system of care. And when you look around at these bubbles, you have all of them in the RHA. You have all the necessary ingredients: substance abuse treatment, mental health, veterans, youth, seniors. Project Touch is a family services program primarily, but does serve individuals. Criminal justice, healthcare, and housing. So prevention is one I'll mention just because of the school districts in your area. They are on their heels with families that are experiencing homelessness or at risk, housing insecure. And those families are frequently undercounted in the point-in-time count. Homeless families are less visible. And when you look at a homeless count and the demographic numbers, you're going to see that's not a complete number with regard to homeless families. This is a slide I also will not go through in too much detail. It's straight off of the county's website, but it shows you just the tremendous capacity that the Riverside County Continuum of Care has, from its housing authority, its continuum of care, the funding from the state and federal government that passes through the continuum to local jurisdictions. So it passes through a lot to service providers, but when cities pay attention to that, the cities can also apply for the funding as well and then pass through to its selected service providers. And you may see some of that happening with regard to the HAP Round 6. So I've talked about all of these things. I'm winding down my comments, but 26 recommendations, primarily data collection, regionalizing your outreach, the encampment response protocols. If one city's displacing a population, it's going to be brought to another community. So rather than displacing folks, let's connect them to the resources. So I forget what it's called, Healthcare in Action program is relatively new. It's happening in a lot of jurisdictions. It's pretty amazing. The ability for the medical providers to outreach to the population, they tend to reduce the number of contacts that we'll need to have, because the medical aspect is a little bit different than a law enforcement officer saying you want to go to recovery. A person would be maybe less likely to engage in that interaction or that discussion, but under the medical guise of let me help you fix this wound or let me help you take care of your blood pressure, more likely for a person to engage in that type of relationship and narrative. So being able to get people into programs is the ultimate way to reduce homelessness in our communities. The shelter beds, I talked about a goal of 60 across the region. Better collaboration with the continuum is something that's going to have to be a divide and conquer among the 5 cities. You can't all do that, but you could do it together pretty well. And then the governance, which I think we're here. The action plan, the by name list, I mentioned to you on the 18 people. If you focus on the people that are in your city over time, those 18 people, and getting connected to the resources that they need, that's going to be the greatest bang for your buck on investment. Utilizing the HMIS system, I've asked all 5 cities to gain a user license for that system, and the county has agreed to give those to each city so that at least you can see it on the back end and determine which clients are in your community and are they in that system. And then the funding that's coming up and behavioral health, which you guys are already doing great on. So with regards to all 5 cities coming together, there's many options for doing that. You can do it as a JPA, which is a more formal agreement, more a governance structure. From our perspective, we actually recommended just an MOU arrangement because you haven't identified at this time any sort of a shared funding need that you're going after. That's more of a JPA agreement, but an MOU is really just getting principal leadership from each one of your cities to do a shared leadership structure to begin to start looking at some of these things related to data and funding and integration with the county.
May I ask a question? So we did an MOU in 2016 with the five cities.
It was a resolution.
Joint resolution. So this would be taken a little step further?
Yes, yes. An MOU would just be kind of outlining, and I think it's on this slide here, is identifying a leadership structure in the MOU, creating subgroups to address data, COC participation, funding, and any other priorities that the 5 cities identify. It's a no-cost MOU. The cities are asking what's it's going to cost. It doesn't have to cost any more than you've already invested initially. You know, you may determine that one of your cities has a location and wants to create some shelter beds for your use. From there, you may decide that you want to do a cost-sharing approach to support that goal or that initiative. Aligning your data, looking at the encampment resolution funding, and integrating with the county. So there's a lot of things that you can do as low-hanging fruit that doesn't cost additional funding. Ooh, I think that was my last slide.
All right, thank you, Ms. Price. So stick around because I think there's going to be a few questions. And just so the folks in the audience know, there will be an opportunity for speakers to ask a question that could be answered by the professionals or give some input. But first, we're going to take questions of the council, and then we'll open it up for public comments, and then we'll discuss a little bit more about going forward. So with that, I'm going to start in the queue. Councilman Carwin's first with a question.
Thank you. I really appreciate your presentation, and I know the people in Menifee appreciate it as well. You mentioned that one of the largest factors in continuing homelessness is mental health and drug addiction. Has there been any research into whether that's cause or effect? Are people becoming homeless because of mental health and drug addiction, or are they becoming homeless which leads them to mental health and drug addiction?
That's a great question, and I would have to answer it's probably a little of both. You know, when you experience homelessness and you're out there on the streets exposed to the elements, you know, I would say most people that I've come in contact with have a clinical depression at the very least. But when you think of like Axis 1, people that have you know, schizophrenia, bipolar, other types of more chronic and persistent mental health conditions, having difficulty navigating the system, the mental health system. I mean, even families of people who struggle with mental health conditions are having trouble navigating that mental health system.
Well, I guess specifically what I'm trying to find out is someone with a mental health issue is not homeless, and then they are homeless. How does mental health make somebody homeless?
Yeah, that could be any range of, you know, reasons.
Yeah, are they
why
kicked out of their
somebody-
home? Do they wander off? I mean, I'm interested in the origin of the homelessness, and when it comes to mental health, I'm interested to find out what we can do for prevention for our population that would prevent people who are suffering from a mental health crisis to then fall into homelessness.
Sure,
Ms. Villarreal would like to respond.
go for it.
Ms. Villarreal with RUHS would like to respond to some of your questions, sir.
Thank you.
If I could squeeze in. Honorable Mayor, City Council members, and guests, I am Dr. Larissa Villarreal with HOPE. I'm the administrator there. And thank you for your question. As Ms. Price noted, it could be several issues leading to homelessness. Of course, mental health being one. Folks that could benefit from conservatorship are oftentimes misdiagnosed or not treated in the way that they need to be successful because they don't have appropriate resources through family or medical insurance. And so they could become homeless because their families don't know how to care for them properly. And being homeless for long periods of time can compound the mental health issue that they're experiencing.
So again, my question, my focus from the city's standpoint in looking to reduce and eliminate the homeless population is there anything we can do before somebody is homeless who is leading that way because of a mental health crisis? Anything that we can do to stop that from happening in the future or lessen the possibility?
I would say education. So having opportunities in city council meetings like this, educating parents through school districts, I think are extremely important. And also utilizing the services that are available through Riverside University Health Systems Behavioral Health. Thank you.
Next in the queue is Councilmember Sobek.
Thank you. So I just want to go off of what the doctor said here. Right after COVID, we were concerned, some residents, leaders throughout the community, city council, of suicide, depression coming out of COVID. So we did create You Matter, and they are still having meetings, and we have worked very closely with University Health. We found out that we didn't need to create a program, that all of those resources were already available, and we actually, Chelsea in our community services department works very hard on that. And through that collaboration, the school districts were involved, and they were able to receive more information as well for that preventive piece. So I just wanted to share that. But one thing I didn't see on the action plan that I thought we should add to it was the education element. So talking about these that I carry around, the Responsible Compassion Flyer. This was created through the original collaboration that we had on the original homeless task force, which I was a part of as a city council member regionally, and then brought back a homeless task force to the city under community services. Jason Hendricks led that. And we had many meetings at the Case and Acero Center. But what I see not happening is the education as one element for our residents. I talk to residents all the time that don't know that we have a responsible compassion program in the city, of the do's and don'ts, so that our homeless, when we have our outreach team visiting them, that they're ready for services, that maybe somebody just the day they're going to accept services, and then that day someone hands them $20, and then all of a sudden when the resources come the next day to provide the individuals to provide the resources, they go, forget it, I don't need the help. So this is something that I would like to see beefed up in our community and in the 5 cities, is that we continue the education to our residents to give that hand up. If you really want to help a person, provide that donation to the organizations, but then people don't know which organization. So I'm constantly telling them in my city, it's the Menifee Community Cupboard, it's the Menifee Police Department, and then the school districts, because the school districts have liaisons, and they are always in need of gift cards and donations. So education is a very important part of the element. Like it was said, we have very generous people who want to help. But going through the homeless task force, I can't tell you for a few years how many meetings I attended and got educated, that it's multifaceted. It's not one easy answer. I continue to receive those emails from COC. Every few days, there's lots of meetings. And so I'm glad to see that's going to be part of this. And I'm looking forward to this going to the next level. And for instance, I've had a conversation. We have a shelter in our city. It's a domestic violence shelter. They would open their door to partner to be able to provide beds for women and children that are found on the streets. Because a lot of times they are homeless because of a domestic violence situation, but in their contract that they have right now with the church where they're buying the property from, that individual, that woman or child, the women and children, they have to be in a situation with a partner to be able to receive, to be able to stay there. So that contract could be taken care of, a new contract could be made, but they're willing to continue to service those women and children that are in our area. So we have a resource here and would like to provide that information, that maybe that's something that we can move forward in our city to be able to help the women and children that are at least on the streets that have experienced domestic violence that are now homeless. So just a few things, but education, just we need to be able to, if we need to expand this, if we need to put more information on it for our residents. The one question I get all the time is, if I come upon a homeless person, who do I call? And that number is Riverside University Health. That number's on here, Home Connect. And I don't know if that's still the right contact, but we've got that on here. So a little bit of comments and questions that could we add education to one of the elements.
All right, next in the queue with question is Mayor Pro Tem Dinas.
Thank you. I want to ask you about I guess this is a long-term plan. It's understandable. We're not going to fix everything overnight, but the report's given us some, short-term things we can do to at least get started on it. So I'm kind of focusing on that in slide 22. One of the recommendations is to do to regionalize street outreach teams, and then on slide 23 it says align street outreach. Could you? What does that mean exactly? I guess is the first question.
As it stands now, there are basically two nonprofits that are working. One operates in 2 cities, the other one operates in 2 other cities. It's okay for cities to have the autonomy to choose who their providers are going to be, but the important piece is that on the ground, when you're talking about, like, say, the 18 people that are in your city, that the nonprofit outreach teams know who they are and are integrating with what's happening in the other cities with regard to their high priority people. I call that the by name list. Being able to know who those people are in each of your communities, because they will travel between jurisdictions, and being able to address their needs without just kind of starting from square one every single time. And when you have a regional outreach team that can go across borders, it's just more effective than having kind of a restriction to, oh, well, they cross the street now, they're in a different area. It really does help. And that's why with the encampment grant, you've got 3 different cities. It's one Murrieta Creek that covers all 3 cities, but there are encampment locations throughout there. And so regardless of what the city borders are, the populations don't see those borders. So that's just getting the outreach teams to communicate either through the database and integrate their efforts with the populations that they're having contact with.
Okay, that's great, because Menifee's gone a different direction on our homeless outreach and crisis intervention than what our surrounding cities have, and I was worried that that we'd force all the cities into doing it one way. I didn't want to make sure that's not what this report was recommending. So, and part of what you said is the HMIS. That sounds like a great idea, because it's kind of like, when you go to one specialist and he gives you medication, you go to the next one and they do something else because they don't communicate, and next thing you know, you're less healthy than you were when you started. But my only concern is that you said that law enforcement isn't able to access that, and I'm sure I can guess what the reasons are, but whether that's a good reason or not is another question. Would that mean that Menifee has to set up a separate team to be able to access that and to be able to work with the other cities, or would our civilian staff, I'll call you, have access to that so we can do it without having to completely redo our homeless program?
So related to the homeless management information system, although law enforcement cannot do data entry into it, our HOPE team through RUHS, they do utilize the system. Part of the problem that came out of this assessment and conversations throughout the region is, although some are accessing it, people are putting in different information. So it's really standardizing that information so that it's digestible in the same way by everybody. But our city does enter information into that through our UHS Hope team.
Very good. I was hoping that would be the answer. Yeah, I guess finally, with the new executive order by Newsom that, for their safety to start, breaking down the camps and stuff like that. I'm going to assume that the program, the grants that are out there are still remain to go after. That nothing's changed that through the executive order that he's given or anything like that. Because I know there's more than just the executive order to do it, but there's some, the cities have said, hey, you got to do it, certain things, or else as well. So there's a kind of a two-edged sword with what the governor is making cities do.
Yeah, and there's also been, cities concerned about, having funding retracted if they didn't comply with certain, components of that. The funding for homelessness is changing. What the state has been putting out over the course of the last 6 rounds of the HAP program that I mentioned, round 6 is out. We don't know whether there'll be a round 7. But what we are seeing, and a lot of people are concerned, they're seeing that the funding that we were getting is not coming down in the same way. What we are seeing is things are changing maybe for the better, meaning that, there's that mental health ballot measure, Prop 36, I believe, is coming out. There's kind of retooling of things. The Cal-AIM program, which is a Medi-Cal waiver program, which is kind of on a healthcare response, that's what's funding the street medicine programs. So while the funding might be shifting, maybe it's shifting in a way that's beginning to directly address the needs that we have in our communities. So I'm seeing that and I'm appreciative of it. But I also know that HAP Round 6 is a great opportunity for the cities and the RHA to go after that for a regional street outreach team, just different things that kind of take you out of the individual approach and kind of connect the dots a little bit for you all.
Okay, thank you. Last question. You had mentioned earlier that, with family homelessness and things like that as well. I mean, when we think homeless, first thing everyone goes to is, the guy that, the person, that hasn't showered or bathed forever and, sitting in the corner talking to himself, with the mental health issues. But, we also have families that, are, what they call couch surfing is the term they use, or living in their car, or I've heard that they even live in horse trailers because it's something over their head. Mm-hmm. But that doesn't seem to get as much attention. And this report seemed to be more along what we see now as homelessness as those that need, intervention because of, drug or mental health issues. My concern is that we lump everything to one, and then the family part there, it gets kind of overlooked because we don't know how many there are in this region that could use assistance as well. You get, you get a family living in a car it's not good for their health. It's not the children don't get to school as much and all that kind of stuff. So I think, I would hope that we'd look at that as well as just the people that are living on the street. I mean, has that been discussed or anything?
Absolutely. It is addressed in the report under prevention. When we talked with the school districts. We weren't able to talk to all 5 school districts, but we got data from 2 of them. Just as an example, there were 400 homeless students in one of the schools, and there were 500 in the other. And what that shows you, and that's not 500 families, that's 500 children or students. They could be from some of the same families, right? If there's 3 kids in that district from the same family. But those populations are just as at risk to homelessness, even though they're not homeless by HUD definition, they're not literally homeless, their crisis is no different. And so when you're looking at families, as I said early on, the homeless counts have a difficult time capturing that population. They're often hidden. Their kids are staying with a family member while they, look for work or try to stabilize their families. They're not sleeping outside, generally speaking, or as you said, maybe in a horse trailer or an RV or in a car. They're just harder to capture or quantify. But the best way to quantify that population for your jurisdiction is through the school district, because they do maintain data on that.
Okay, so my other last question. So, and then on slide 14, you show there's, on 2023, there's 419 homeless, then that does not include then the 300 to 400, 500 homeless people that were identified by the school district.
That's correct.
That's correct. So technically we have, the issue is twice as large as what it really is that the ones with mental health crises or drug addiction are, is it right to make, are they the priority then? Or, I mean, I guess, how does the family element tie into all this then? Because it seems to be very focused on getting those people off the street, but not as much as the families.
I would suggest to you that that is the objective of the RHA. All 5 cities, your councils, all of the councils have been prioritizing the families as well. So when you look at resource development, you may decide that you want to create a resource for families. It's not just one population. That's the difficulty of homelessness.
Right.
And then it hasn't been mentioned here, but seniors. The single largest growing population in the homeless population is seniors. Just simply cannot afford housing with their fixed incomes. So senior housing is an important component as well.
Great. Well, thank you. I appreciate that, and that the family and senior issues are being addressed as well, because those are important aspects. Thank you. That's all I have.
And I really like that answer about partnering with our school districts, because I know that they've got McKinney-Vento numbers that are 200-300 per district, and we've got a couple of school districts in our city. So, all right, we got quite a few in the queue for questions. So next up is Councilman Estrada.
Thank you, Ms. Price. So we are signing a MOU with the other 4 cities. I'm not sure if I misheard you, but did you say all 26 recommendations are not required to be complied with? I mean, ideally, you want to work as a team, right, and carry out those 26 recommendations. But did I hear you say not every city must follow all 26?
This project was for us to create an assessment and an action plan. What we did not do is negotiate an MOU with the 5 cities. So that's work that remains to do for the 5 cities to come together and determine which of the recommendations you want to proceed with. Maybe there's others that aren't as listed here that you want to prioritize. That would be things that you would put into your MOU going forward.
Thank you for that clarification.
Yeah.
And then I wanted to talk a little bit about the fiscal impact of these recommendations. On slide 24, we talk about the encampment resolution grant that's pending for $12 million, and then integration with the county for their funding. Now, I didn't see anywhere in the presentation a cost impact analysis of what every city would have to do should the grant not be approved. Is there a cost estimate of carrying out these things without help from the county, without grant help?
We did not do a cost analysis specifically because we don't know which things the cities are going to proceed or go forward with.
Okay.
And it is all pretty much contingent on funding capacity. So a lot of times, in what I know in working with cities and counties and trying to build a system of care from where your starting point is, and figuring out where can we, bring in additional funding to move in the directions that we want to move. So in the case of the encampment grant, if you get that grant, then you're going to be off and running to work on, that strategy with the Murrieta Creek, which isn't in your area. But then when you go for the HAP grant, there may be priorities that you want to do. So as I mentioned, in the MOU creation is creating that leadership structure that's a shared leadership structure that your needs and priorities are weighing in how the MOU goes forward to apply for which types of funding to meet the priorities that you have. It would be impossible to encapsulate, which things are, what they would cost going forward. There's a money investment that each city has already made on existing staff also. So, it's just really a matter of incrementally moving forward in the directions you want to go and then bringing funding in to support those
Okay,
initiatives.
thank you. That makes sense.
Yeah.
Thank you.
Next in the queue with question is Councilman Carwin.
Thank you, Ms. Price. I'm going to take you off the hot seat for just a minute. I got a question for Captain Gutierrez. One of the things we've been hearing from our businesses and our citizens, their main concern with the homelessness population is their interaction with the residents as far as criminality goes, assault, robbery, things like that. And because I know I did a ride along with Officer Miller recently, and we encountered several individuals whose citizens were reporting as homeless who actually weren't homeless. They just sort of looked disheveled. But what is our schedule? Does the POP team work 24 hours? We don't have the personnel for that. I know Rochelle Hunter can only work so much. So what are we doing in the evenings and the overnight hours for proactive policing for homeless?
Yeah, so proactive policing has always been a priority for us. So no, the POP team does not work 24 hours a day, 7 days a week, but we do have patrol deployments that do. And so we fill those gaps with patrol officers that do go in those areas where, as Susan Price mentioned, hot spots where we know that homeless individuals can congregate. They do proactive patrols in those areas. And just some of the enforcements that they do, they do proactive patrols in vehicles, bikes, on foot. We talked about a little bit about 602. Those are trespass notices, so we can use that as an enforcement tool. We do shopping cart violations. Some of these individuals have warrants for their arrest, and so they ultimately end up having to be held accountable for their warrants. Probation and parole. A lot of the individuals are on probation or possibly parole. Narcotics violations, aggressive panhandling, public intoxication, shoplifting, and the list goes on. But our officers are all committed to, no matter whether they're homeless or not, if they're committing those acts of violence or breaking any law, our officers are very proactive and they do a lot of hard work holding those individuals accountable.
So since we held the forum on August 5th, I don't know if you were there.
I was.
Yeah, you were there. Chief Carr was there. I know Eddie was there as well. Have we taken any steps to change our policing with pertaining specifically to Cherry Hills Plaza and that area where the majority of our homeless population congregates? So since then, in that response, have we done anything to change our ways?
Yeah, so our POP team has done some special enforcement out there, special operations. They've adjusted some of their hours, so they're out there later into the evening. Our direction has been to patrol, to do extra patrols out there, not just driving by, because cops drive by that area all the time, but sometimes it's a quick drive-by on their way to somewhere from somewhere else. But our direction is get out of the car, walk through the shopping center. We do bike patrols out there, those types of things. And we've done the responsible compassion. We've hung more door hangers out on businesses and residents throughout that not just the shopping center, but the community that surrounds the shopping center. And we have, to your point, Councilwoman Sobek, we are trying to make more of an effort for that education. We have that flyer, that information now on our website that people can access, so we're trying to do more with that.
And there's just to put a bow on it, the last thing I want to ask you about is, have we noticed any improvement in people taking resources, criminality down, reports of crime down? Have we noticed any results from this change since August 5th? I know it's been a little over a month.
I think the calls for service, have been fewer. As for contacts over in that area, I'm being nodded to, yes, that there have been some reduction in contacts in that area. So the efforts are working. It's an all the time effort. And some of this is going to be, being able to look at, in conversations with Marietta and being able in Wildemar and Lake Elsinore and Temecula is how can we work regionally to, get these people off the streets, these individuals that want help. If we can do that through an MOU and get access to more resources, then I think we're going to be better off. Now, there is always going to be those individuals that no matter what resource we have, unfortunately, there's a percentage of them that won't accept them. But that's where we contact them 100 times. That's where healthcare in action is going to come into place. Maybe they have a medical need, and if we can help them with that, then they'll begin to trust us, and we can make progress with them. So it's an ongoing effort.
All right, well, I noticed that the numbers are going down, so I appreciate the efforts we're making, and I just ask you to keep the pedal to the metal on that, and let's keep going. Thank you.
Councilmember Sobek's next question.
Yes, thank you. In the region, we identified that there was a need for detox facilities. And I know at one time the Menifee Hospital stepped up and created a detox facility. Are we aware if that is still going on there?
I'm going to let Carrie White come up and answer your question, ma'am.
Menifee Global Detox is still on the 3rd floor at the hospital.
Okay, thank you, because that was a regional effort as well. Also, going back since, you're good, Carrie. Thank you. Thank you for that, Carrie. Going back with the responsible compassion and the education, maybe we can, and I know it's off the subject a little bit, but we're talking about homeless and education for our residents. Maybe using Menifee Matters at least once a year, having that brochure in there so the residents can see it, and maybe some of the major HOAs in the Sun City area that have large newsletters, that can be an element sometimes in that, just as a suggestion. Could we do that?
Yes, absolutely.
Okay. All right, thank you.
So, Captain Gutierrez, I have a question, and it was actually a question that Councilmember Estrada brought. He was kind of wondering about available beds, and we know some of the other cities have repurposed hotels and stuff, so we kind of have that image in our mind. And then his question was about Project Touch. What is it? Is it a residence that's like a recovery home, group setting, that sort of thing?
Yeah, so I wanted to mention that while it does represent that Menifee has 12 shelter beds, it's not a homeless shelter that some people would think of when they first hear that term. They are repurposed. It could be a residential home that's a 4-bedroom, 2-bath. But to the outside folks, they're run very well. Project Touch does an exceptional job. They have case managers that run the sites. And I can tell you from a police standpoint, we don't get calls for service. They're helping these individuals, and they're able to get them off the street and into a bed.
Excellent, great, thank you. Does that, Councilman Estrada, does that help with your question? You were kind of wondering, where is our 12 beds, and so.
Yeah, I'm still wondering where it's at.
So it's at a residence.
Yeah, I mean, we're not going to give the addresses here in an open forum. That would confidentiality. But they are in the community. They're in most communities. And the cool thing is that you don't really know about them.
Okay, thank you.
And then it was suggested that some other cities may have kind of a self-surrender location at a police department or something like that. Where would you recommend something like that be if we were to move forward with that? Someone could come and say, hey, I need help.
Yeah, so those access points are going to be something that staff is going to research, like where would the most beneficial site be. I will say, we do have the number on the Responsible Compassion flyer, but it's been talked about in the past, what number can somebody call? What number can a member of the public call? Our suggestion, we have that number, but if you don't know any other number, call our non-emergency number, because our dispatchers can get an officer or a staff member connected, and then we, as staff, can get them to the right location and get them the correct help.
All right, very good. Thank you, Captain. So I don't see any more questions in the queue, so at this point, Madam Clerk, do we have any correspondence on this item?
No correspondence.
And how about any speakers from the public?
We do.
Let's go ahead and call the first one.
I have Dory, followed by Florence.
All right. Please do, Ms. Ray, because we're going to need it to be recorded. People might be watching online. Thank you for coming. Welcome.
Dory Ray, I live in Menifee, which is actually Sun City back in the day. And so now I live in the core. Prior to that, I worked for the school district, lived in the Evans Ranch area, Canyon Lake. And so for 45 years, I've been here and seen all the progress that we've made, which is great. But I only wanted to ask you if you have room for volunteers. And if you do so, I can give you my information, because I would be more than happy to volunteer my time and efforts, since health-wise I was forced to retire from the school district. But I am able to do things, and I would like to definitely help at least our senior citizens in the core and elsewhere. So Lisa knows my information, so if anyone would like to utilize that, I'd be more than happy to help out.
That's
Thank
very
you.
kind of you. Thank you.
Thank you for coming out, Dory.
I have Florence, followed by Devin Lamon.
All right, welcome.
Hi, my name's Florence Locke. I am new to Menifee. I come from Los Angeles. I have worked along with security in the part of the hospital to where, unfortunately, when the homeless get bought off the streets and the police have to take them to hospitals, how they are dealt with and how they are connected with the resources. And then I was transferred into working into a homeless shelter. And it is one difference when you say, okay, I volunteered at a homeless shelter because you're only there a short amount of time. But when you actually go and spend time working and practically living in a homeless shelter, the resources that they really get in the shelters, they are not truly connected with. They are supposed to be able to get their medications. They're supposed to be able to have a place to where they can take a shower, get healthy food, connected to the resources, connected to case managers, housing navigators. They are just not connected into the resources. So my suggestion is if we do have a resource in our city, we need to make sure that they are truly into the places where we place the homeless. They need to have 24 access to these connections, because they just, typically they don't have it. And then when we're having outreach with a lot of people, a lot of times is the reason why it's taking so many times to connect with them is because of stereotypes. They're thinking they're being stereotyped. They think they're being judged. So they're not truly giving you the reason of their unfortunate. And then the police, yes, they do a good job, but they're scared to talk to the police. They're scared of the reaction that they're gonna get. And sometimes I think maybe if the police were more trained on to how to identify somebody's mental state, that would crack down on a lot of problems that they may arise.
All right, we appreciate your input, Florence.
Devin Lamon, followed by Tom Furman.
Welcome, sir.
How you guys doing? Good to see the community out here. I was really excited to hear this subject come up because it's a really close thing to my heart, being that these people are part of our community. A lot of people look at them as like a pest or something, or like, oh, they're giving the city a bad look, but it's really an example of how we could fail as a society or as a community to let these people just live on the streets, you know? My uncle was alcoholic, and he went through homes after homes of friends, and after that it became programs that would kick him out, and it goes down a road to nowhere, you know? Like it motivated me. I started a little group at my last place of employment where we would gather all our tips, not all of them, but you know, whoever wanted to donate, and we would buy socks, food, and go out twice a month and go do this. And then I was like, what do I do after this? So I partnered up with a friend that builds like tiny homes, or like not ADUs exactly, like a little separate office that people could work out of. And we started building these tiny little homes for them to go into in like a time of crisis. And all of a sudden the city over in Oceanside cracked down on that and said, you can't be doing that. So honestly, as a citizen, I could do so much. I could give them food, I could talk to them, I could pray over them. But what can we do as a citizen to help these people? That's where I'm stuck. The government could throw money at a problem, and as long as you guys don't do what Oceanside or San Diego or LA is doing, because that's not working at all. So my question is, what can we do as citizens? I know the number one problem is the lack of immediate housing. Once someone puts their hand down and says, I'm done with his addiction, I'm done being on the streets, and they have to go through some program and get no help until like 90 days. So My question is, what I want to do, a vision I've had for a long time, is to be able to build little crisis homes where they could take a moment, get off of the street, because the number one problem is that they're in an environment and they're a product of that environment. They're around people smoking drugs, people drinking, fighting, all this crazy stuff. They need to get removed from that. So my question is, as a citizen, am I able to build a little crisis center to help bring someone in and then use the county resources to help them get back on their feet? Thank you.
All right, thank you, Mr. Levin. We obviously have some compassionate people, and I would encourage you to speak with our captain about your ideas, because he can help you with that. That'd be awesome. And Mr. Furman's next. Welcome, sir.
Glad to be here. I think this is going to be a little bit entertaining because you've all seen Yellowstone. And when someone walks up Mr. Dutton's driveway, the first thing he says, go in and get something to eat, and then see Rip afterwards. They go see Rip. They walk over to the barn. He gives him a wheelbarrow and a pitchfork. He says, clean up those stalls. He cleans his stalls up. He says, okay, you got a job. Another one, he went out, this one kid went out to the horse corral, and he says, walk in there to that horse. And the kid, he says, just walk up slow. He walked up slow, pats the horse. You got a job. And the biggest thing is, we got a little Yellowstone right here at the Wood Nickel Ranch. Because in the last 30 years, I've taken in over 25 people that walk down my driveway, homeless, no place to turn, need a job and a place to stay. And I've schooled them under my wing, and I've taught them how to pound nails, how to take care of horses, how to build stuff with their own hands, and how to cut trees and trim trees. So of the 25 people that have been through my ranch, 3 of them come out as heavy equipment operators, 4 come out as carpenters, 2 come out as tree experts, and 2 of them became horse trainers. So the biggest thing I'm saying, if you take someone in and help them out, give them a job, get them working, and that's what I have done in the past 30 years for 25 men, 2 women on top of that. And they've all found better jobs and got on with their life. One guy came to me in 1994, okay? No place to go, needed a place. So I was tiling a bathroom. I says, come on, help me tile this bathroom. Well, today he's one of the best tile setters in the valley. But he still lives on the ranch. He don't want to leave. So I'm saying you can create a place for them to sleep, but I can teach them how to work. And that is, I think, the best plan. And I'm volunteering my tumbleweed paradise, whatever you want to call it.
Mr. Furman.
Okay, as a place to take in some homeless. I got 2 empty beds right now.
All right.
All right, thank you.
Thank you, Mr. Furman.
No other speakers.
No other speakers. All right, so at this point, and maybe Captain Gutierrez, you can kind of help guide us, because what we're looking for now is a discussion by the council, just kind of this whole Homeless Alliance assessment and action plan, and it was suggested that by Ms. Price that we look at the difference between an MOU and a JPA and those kinds of things. So that's really what we're going to be talking about at this point. Where do we go next? So.
Yeah, so what staff is currently doing is researching all of those various options. Of course, there is a funding request that likely would come with that. But by entering into an MOU with at least some of the cities within the RHA, we become more competitive to receive grant funding and get us to a place where we can provide more services. And I'll assure, one of the public comments was talking about jobs. That is part of what RUHS does, is try to do job placement and get them connected to employment so that they can start, supporting themselves. That is a long road. It takes time, but that is part of it. But staff will be researching grants, working with other cities within the RHA, how our existing resources can help benefit them, and then how their resources can help benefit the city of Menifee, and working together enter into an MOU. So we're doing things consistently within the region and reaching the people that we need to reach.
I agree with that. Council members, your thoughts? Are we on the right track?
Yep.
Everybody feels pretty good? All right.
I just want to say I'm really impressed with the program that we have in place, and a lot of people don't know how much we're doing, and a lot of people don't know how much more burdensome of a problem it could be for our city if our team wasn't doing what we're doing. And I just want to say it's working, and for whatever we're seeing, it's really working, and I'm impressed by it.
Thank you. We do have a fabulous team, and they're doing great work for the community.
And that's our team, but we got a great partnership with the county too, and with clinicians that are riding with our officers. I just think that makes so much sense, and really is turning out to be a good program. I don't want to go away from that. That was my concern. If we're trying to align with other cities and be similar, if we're doing something that's really working, I don't want to go away from it. So.
I think there's opportunity to commingle what we're doing, what they're doing, and look for the best, all the best options.
Yeah, I agree. I think our city manager, Mr. Villa, wanted to say a few words.
Yes, so the objective of today's meeting was to be able to present information to you and get your feelings on what the next steps ought to be. Obviously, we are still part of the RHA, and we are going to be visiting with the other cities. I think, Brian, the Baker Tilly group is going to be making their rounds to other cities, and also letting their councils know of what the next step should be. And once that's completed, I think we're going to come back to council and put together some options for you, which could be an MOU or some kind of a format, governance format, to be able to move forward with some of those things that we need to do to be able to get to that next level. So today, you don't need to take any action. We just wanted you put this in front of you, and I think we have enough information from you now to be able to make assessments and meet with the rest of the other cities.
Is it okay to ask Mr. Ambrose, I see that there's 166 available beds in Marietta. I'm just curious where those are. Are they similar to us where we've got residential units, or do you have a hotel that you've repurposed, or how do you get so many available beds?
No, it's a various different housing stock. Brian Ambrose, City of Marietta, various different housing stocks. All Project Touch. We've been very fortunate. Project Touch started operating years before we got started back in 2016, which Councilmember Sobek was part of. Project Touch has very deep pocket supporters. They don't take county funding, they don't take state funding, but they've been able to cobble together fourplexes over in a certain area of Marietta, as well as residential houses. The ones in Menifee are likely houses and therefore transitional housing. So this is after a period where someone goes through emergency housing. Our process right now is a 21-day emergency housing where you work on your housing sustainability plan. If you're working on that consistently, that time can be extended. Once you get to that point, hopefully we already have you working, you have a job, you're ready to transition. That's transitional housing, where 30% of your income goes to the Project Touch, and then you keep the 70%. And then she actually makes everybody start a savings account. She holds on to, but when they leave, they also have first and last month's rent already ready to go. So she owns, I say she, it's Ann Umar from Project Touch, owns those facilities. So 165 are some emergency units, some transitional, and then some other types of homeless services.
Thank you. That's very interesting to know. Do they also offer wraparound services and other things for those residents, job placement and drug addiction assistance and that sort of thing?
Sure. So when we first got into an agreement with Project Touch, we did something that's very unique compared to some other cities. In my mind, it's an inherent conflict to have Project Touch also be the case manager. It can work in some organizations. Murrieta pays for a case manager from CityNet, that's our street outreach firm, but to be there full-time at the shelter. This way, it takes the incentive. The vast majorities of shelters work under a bed per night incentive. So if you do that, in my mind, there's not much incentive to get you out of that bed and becoming a functional member of society. So when we put CityNet there, they have 21 days. And again, can be extended if someone's working towards their housing sustainability plan, but it's 21 days and you need to figure out what your next step is, whether that is the detox, whether that is residential alcohol, whether that is mental health services. One thing I do want to point out, we've had that shelter in Murrieta since, she probably opened that up in about 2016. We formally went into an agreement since 2018. Since that time, I have received 2 phone calls of complaints about the emergency shelter. That's it. One was a legitimate call. A gentleman had a mental health crisis at about 1 o'clock in the morning, and neighbors were upset, as they should be. If he wasn't in that shelter, he was still going to have the mental health crisis in the middle of the street. But we took care of it rather quickly. The other one was a phone call from a resident living that thought they knew where the shelter was and wanted to complain about it. Went to one of our council members as a complaint about not taking care of it, that the landscaping was very poor. I had just been down there the day before, so I ran down there and made sure, and come to find out the address that they gave wasn't even Project Touch's house. So 2 phone calls of complaints in, let's call it 7 years. They operate a tight ship. There are problems. There's no such thing as a beautiful shelter. Go through any of the shelters in Riverside County. You're taking people with, chronic illnesses, chronic substance abuse, and you're trying to make them better. Very difficult situations, but you can do it in a way that's humane, and you can do it in a way that sets them up for success. So thank you for the time.
Thank you, Mr. Ambrose. I had a feeling you'd be very helpful with this, so appreciate you being here today.
Thank you.
All right, council members, anything else we want to discuss? All right, hearing none, we will go ahead and adjourn our workshop, and it is 5:42, and then we will be back in about 20 minutes for our regular city council meeting. Thank you, everybody, for being here today.